Welcome to CME on ReachMD. This episode is part of our Minute CE curriculum. Prior to beginning the activity, please be sure to review the faculty and commercial support disclosure statements, as well as the learning objectives.
This is CME on ReachMD, and I'm Dr. Karin Blakemore, and I'm here with Dr. Emilie Vander Haar. Dr. Vander Haar, could you describe FNAIT and how patients usually present when we know there might be an affected pregnancy?
That's a great question, Dr. Blakemore. As you may recall from our prior episodes, FNAIT or FNAIT is defined by the presence of maternal antibodies formed against specific fetal platelet antigens, leading to destruction of fetal platelets and fetal and neonatal thrombocytopenia. Fortunately, FNAIT is quite rare, occurring in about 1 in 1,000 births, depending on the literature that you look at. Thus, most women are at low risk for this disorder. Unfortunately, it is actually difficult to predict which women are at risk in the general population, as there is no universal screening strategy for FNAIT at this time. Currently, the most useful predictor of patients at risk for FNAIT is actually a previous pregnancy affected by FNAIT. So typically, most cases of FNAIT in affected women are not diagnosed during their first pregnancy. Furthermore, there is no non-invasive screening test to monitor for fetal thrombocytopenia. Thus, an alloimmunized mom with an otherwise normal, healthy pregnancy can deliver a baby that's noted to have easy bruising or bleeding, and the neonate is subsequently found to have thrombocytopenia on testing. Genetic testing of parental platelets can be performed, and serum maternal antibody status can then confirm the diagnosis of FNAIT in these pregnancies. Occasionally, we can suspect FNAIT antenatally when there are signs of fetal bleeding, usually seen on ultrasound. The most severe sequelae that we've previously mentioned of FNAIT is bleeding in the fetal brain or intracranial hemorrhage, which is estimated to occur in about 1 in 10,000 births. Bleeding in other organ systems with FNAIT has been described, including some pulmonary and gastrointestinal bleeding, but these are really rare and the incidence of these is really unknown. Intracranial hemorrhage can actually occur anytime during pregnancy, although usually between 13 to 28 weeks, with earlier occurrences typically leading to poorer outcomes. Women with a history of prior pregnancy affected by FNAIT and the prior pregnancy affected by intracranial hemorrhage have an estimated 80% risk of recurrence in a subsequent pregnancy, and thus the ability to identify and treat women in these very high-risk categories early in their pregnancy is really important.
That's great. And it is very interesting that the difference between Rh disease and FNAIT is that we don't have first pregnancies usually affected in hemolytic disease of the fetus and newborn, in the red cell alloimmunizations, whereas it does occur, and it occurs frequently in first pregnancies when there's this maternal fetal antibody interaction because of the baby's platelet type, and the baby can be affected the first time around.
It's definitely something that clinically we always struggle with explaining to patients why it's harder to pick up these cases, because unlike in hemolytic disease of the fetus and newborn, where we routinely screen all pregnant moms for their Rh status at the time of their first visit, we don't have that capability in sort of all first-time moms right now. And so when we do find them, or we find an affected pregnancy, we have to sort of work backwards and sort of plan for future pregnancies instead of being able to do more preventive treatment, which is always frustrating.
Right. And once the baby's born, that maybe has petechiae or bruising, or hopefully not, but an intracranial hemorrhage or some kind of pulmonary hemorrhage maybe. We do work backwards, and we generally will figure it out. Well, I think our time is up. So that was a great discussion, and we'll move on from there. Thank you.
Thanks for listening.
You have been listening to CME on ReachMD. This activity is provided by Omnia Education and is part of our Minute CE curriculum. To receive your free CME credit or to download this activity, go to reachmd.com/CME. Thank you for listening.